The opinions expressed are those of the show's host and not the staff or management of Port St. Lucie Broadcasters. Any reproduction without written consent of WSTU and WPSL is strictly prohibited. Now it's time for Quality of Life Radio, brought to you by WellMed. Here are your hosts, Gary Owen and Tom Bouvier.
Hello, Church of the Coast, and good morning, all of our friends listening in on this fabulous Florida Tuesday morning. It's already June 22nd, and I am your extraordinary host, Gary Owen.
And I'm your extraordinary co-host, Tom Bouvier.
No, that would be ordinary.
Oh,
you put a little extra in ordinary, then I guess you have extraordinary. And by the way, you are listening to the world-famous Quality of Life radio show. We're streaming live here in the studio in WSTU studio in downtown Stuart, Florida. And we are proudly sponsored by WellMed, United Healthcare, and Lot Insurance Services. Hopefully you're tuning in, you're driving safely and listening to us on WSTU 1450 and WPSL 1590. And you can catch us live on Facebook. For those of you that are watching Facebook Live, thank you very much. And you can also catch us on the Boob Tube, not the Boov Tube, the Boob Tube, www.wstutv.com. Tommy, why do you think we're all in the studio together?
Well, Gary, we work hard every Tuesday morning, bringing people relevant content, information they can actually use. The second reason we're here is to showcase and support local businesses and nonprofit organizations. They'll be introduced here in a moment. Very happy to have them. And we also bring education and information regarding insurance planning so people can improve their quality of life. That's the name.
That's correct. That's the name. That's our mission. That's what we do. That's our game. And by the way, Tom and I are with this little agency in Stuart called the Owen Insurance Group. You may have heard of us. If you haven't, you're probably asleep at the wheel. So time to wake up and say hi to those of us that are at Owen Insurance Group, just north of the Roosevelt Bridge. And Tom and I, once we grill the heck out of the Children's Services of Martin County, we're going to just really drill down.
I have no idea what's
drill
about
them
to
to
happen.
death. Then Tom and I are going to talk with you about some insurance solutions and ideas. And by the way, today we're going to talk about some short-term medical plans and what does that mean? You know, so many people don't understand insurance. We know that it's a very convoluted, it's a very complicated subject, and insurance carriers make it that way for a reason. So we're here to simplify insurance planning because that is our mission, Tom.
It is.
All right, so this morning we have David Heaton with us. He's the executive director, and also Cherie Rockstar Ramirez, the Children's Services Council of Martin County. Good morning, David and Cherie.
Good morning. We're pleased to be here.
We are pleased to have you very much. And Cherie, say hello. I mean, don't be shy.
Good
Share
morning,
the microphone.
everyone.
Yes. Wasn't that voice just spectacular? Say that again, Cherie. I want to hear that again.
Good morning, everyone.
Now, she really means that. That's awesome. So, David, tell us a little bit about yourself, if you want. How long you've been in Martin County? As long as I've been alive, I think, almost. And then tell us a little bit about the Children's Services Council and your mission.
I haven't been here as long as you've been alive. I've been here quite a while. Came to this community in, 1976. So been here quite a while. Came to work for the Children's Services Council. I'm sorry, I got to get on the mic here.
Yeah, there you go.
Came to work for the Children's Services Council after being with the Department of Children and Families for 13 years. The organization was started in 1988. This is a organization that's created by communities. There was some legislation and statute for many, many years over on the West Coast in Pinellas County, and the Children's Services Council over there was formed in 1949. So the second one in the state was in Palm Beach County, and we shared a 4th District Court of Appeals judge who lived in Martin County, worked in Palm Beach County. So the two Children's Services Councils in Palm Beach County and Martin County formed almost simultaneously in 1987 for them and 88 for us. So what happens is the county commission establishes an ordinance creating a council. There's legislation in the Florida statutes, 901 125901. So that statute allows communities to essentially tax themselves to serve the needs of children and families. So in Martin County, that happened in 1989. There's a vote we go to the ballot, and there's a referendum for that taxation. That happened in 1989. So the organization was formed in 1990, and I joined in August of 1990 as their second staff member, who was doing all their planning, needs assessment, and the work necessary to allocate resources. These organizations are set up to plan, provide for, fund, and create a place for conversation around challenges the community faces on behalf of children.
So you're part of the foundation. You're like the founder.
Yes, I was involved in the first campaign, and we were reauthorized again in 2014. So also very involved in that. So it's been my pleasure and privilege to be part of the organization's start, and certainly part of their success in the 30 plus years we've been around.
So some questions I have right off the bat. So does every county, all 67 counties in the state of Florida, participate with the Children's Services Council? So each one has their own mission. Basically.
Excellent question. The counties have to decide to do that. They have to decide to tax themselves. So there's a process. There are 11 independent Children's Services Councils in the state. Those councils have gone through the ordinance process with their county commissions and had the taxation referendum be part of their voters' question at some point. There were the two newest in the state are in Alachua and Leon County.
Mm-hmm.
So we have been, of course, as a foundational Children's Services Council, heavily involved in those organizations lead up to the ballot and the questions that come before the voters and all of the campaigns. We've been kind of part of that.
And how are you spending the taxpayers' money?
How are we spending it? Well, I talked earlier about our mission, that is to plan and work on behalf of all of our community's children. So we are by statute limited to collect millage of 0.50. This is ad valorem tax, so the value of property. So half a cent for every $1,000 of property value. So in Martin County, we're fortunate here. We have a fairly affluent community, so we collect about $8 million with that.
And with property values going up, might that increase your budget?
It does. We had the millage is capped at 50 cents in Martin County. Over the 30 years that we've been here, we're just at 36 of that 50 cents. So that 36 cents is what generates that $8 million. So yes, when the property values go up, there's additional revenue that comes. If we leave our millage flat, we still get a little bit of an increase.
Very good.
All right. And then tell us and explain to our listening audience and those that are watching us live, what is it that you're doing with the money for the children? So what's the age groups and what are your programs?
We fund programs. I have a little program guide here that goes through all of that, and I'll share that with you so you can have a look at it. We have several funding priorities. Healthy children is a priority that we released this year. Every 5 years, we go through a planning process where we evaluate our community's needs and then establish a set of funding priorities. Those priorities have not changed in the last 10 years. But under each of those priorities are programs that the council supports and funds. And we go through a planning process that devises all of those goals and those outcomes. So we've just recently, as you know, come out of an experience that was completely remarkable and unusual. We had programs that had to close. We had businesses that had to shut down. We went through a pandemic that essentially closed our community. So fortunately, we're in the midst of that able to address emergent needs. For example, what we've learned, I think, most profoundly is the value and the contribution that early childhood education and childcare and the ability for families to go to work comfortably and have a feeling that they can leave their children in good hands. When this whole pandemic thing happened, those kids and those programs were closing down. We were all going home and working from home, which worked out for a while. But then when everybody started to have to go back to work, and you always have first responders, healthcare workers, all of those folks, they worked throughout this experience. So we had to kind of pivot to support our after school and out of school settings. Those are the programs that provide for childcare and take care of kids during the summer and when school's out. They couldn't have 50 kids in a room. They had to have 10 groups of 10, everybody masked, everybody cleaning. They had to move around in groups of 10. Sometimes their facilities, like if I can use the best example, because the YMCA stepped up big time at that time, and they prioritized service to the families that were first responders and healthcare workers. They stayed open throughout this process, but their facilities were limited. They for those kind of groupings, we had to move out into looking at alternative sites because they had to spread their kids out. So they went to the fairgrounds and said, "Can we use your space?" They made those arrangements. We funded the expansions that were necessary to accommodate those new configurations and those new challenges. So that's the kind of thing we do. And I know Gary's looking at the program guide so he can see the examples of the programs that are funded under those priorities.
It's amazing. Feeding Martin County. So you're part of what you assist with the food bank. Talk to us a little bit about that.
Well, our relationship with the food bank is the Whole Child Connection, which is kind of a resource and referral program that when families come in and have no idea what services they need or what programs are available to assist them, they can sit down with a whole child advisor, go through their individual circumstance, perhaps get some assistance applying for state and federal resources like SNAP and food issues. The Whole Child is embedded in the food bank. So food issues were a big part of our pandemic experience. If you remember, when kids aren't in school, some of them, good portion of them don't get fed. So they had to join with our community and the House of Hope, the Boys and Girls Clubs, the other organizations that were trying to meet that need.
And obviously we know the need is great, not only here in Martin County, but throughout the country, quite frankly. And there's a helpline for those that are out there listening and they don't know who to turn to. Who can they call?
211.
That's an easy number to remember, right? I mean, that's a great number. So call 211 if you need to talk, you need information. They're there, and someone will be answering the phone. Is it phone attended around the clock, certain hours of the day?
24/7.
24/7. You put the kids to sleep because they've been unruly for the day, and you're tired and you're ready to lay down, and might be an opportunity to pick up the phone to get some information how this program and these programs can help your child and your children, and those that maybe your neighbors, your friends, other family members need that support. And it's here in Martin County.
Correct.
So we're about to take our first break. When we come back, we're going to listen to the other pretty voice and hear what Ms. Cherie has to say. And we thank you for listening to the Quality of Life radio show. We're here to make sure your life is enhanced and you have quality and love and support. And this is what we have here in the show. So don't touch that dial because we will be right back. our very, very short break. Thank you for coming back to us. You're listening to the Quality of Life radio show. Very, very famous, renowned host, Gary Owen, yours truly, and the Boov, Thomas Bouvier. By the way, a big thank you to one of our sponsors of our show, Lot Insurance Services, LIS. You can trust them for all of your home, auto, boat, business insurance needs. If you're looking to save a lot, not a little, but a lot, call the Lot Brothers, and they're located just north of Midway Road on US 1 in St. Lucie County. All right, so you're listening today to some special guests we have with the Children's Services Council of Martin County. We just had the executive director, David Heaton, speak to us a little bit about the background. Great information, phenomenal programs that's provided here for children of Martin County. And now we're going to hear from the manager of community engagement. She is very engaging. She's got a very wonderful voice, great personality, the lovely Cherie Ramirez. Cherie, what's going on?
Well, thank you very much, Gary. I appreciate it. I don't know how great of a voice I have, but I can definitely talk on the radio. I like to talk. So.
Radio background. I've never known that you didn't like to talk. That's news to me.
I said I do like to. Oh, okay. You're being sarcastic. There we go.
She caught me.
Yeah.
Of course. So I'm excited. I've been with CSC now since March 22nd. Today is actually my 90 days with CSC.
So, David, is she working out, or she's on a chopping block? What's the story here?
She is. I don't have to tell you all about her. She's fabulous.
Big raise.
She's getting an A.
I get an A++.
A plus. Awesome.
That's like A and best.
Yes. No. So there's a lot of things happening here in Martin County, as Dave has been able to kind of go over the needs here in Martin County. And it's my responsibility, which I love, to be able to help raise awareness of the programs and the providers that we have available here that we are able to fund through those taxpayer dollars. So I'm very much looking forward to some new initiatives that, well, I guess it's not necessarily new. We are relaunching our Martin Reads program. And I spoke with you and our group, Treasure Coast Masterminds, last Friday a little bit about the needs in Indiantown and right here in Stewart and Salerno, and the grade level reading issues that we're having for our children. Right in Salerno, let me see here. Only 27 out of 131 passed for being on level at third grade for reading. And the statistics for being on level, when they go on in their adulthood and into high school, into their careers, the issues there will, if they're not on level by third grade, the statistics show that they're not going to be as successful as somebody who is. So our schools do a great job. It's going back home to the parents. And so that's something that we're looking forward to, bringing in this HIPPY program. It's with USF.
It is. Yeah. HIPPY stands for Home Instruction for Parents with Preschool Youngsters, and it's an evidence-based program that we are in relationship with the University of South Florida, who is a HIPPY administrator across the state. They are excited. We are excited, essentially because Martin County is a new HIPPY community, that they can come in here and do some research along with our good work that's going to be working primarily with our parents in Port Salerno, particularly those parents who have kids between 2 and 5 who are not enrolled in a formal early child education system. We see the values in school readiness and the predictor of success in school being tied to those early childhood experiences and some formal early childhood education. Because of the social emotional requirements of attending school, we have a good sized population in this community that doesn't speak English and comes to this community with English as a second language. So Cherie mentioned the school readiness rates in Port Salerno, particularly in Port Salerno and Indiantown. Those are our challenge communities when it comes to that. We have about 47% of our kids just countywide who read on grade level by third grade. We need to be at 80, 90, 100%. And it's a challenge.
That's a big challenge.
So the work that HIPPY's going to be doing is foundational. We also have some other spokes in the wheels, if you will. There's a program going on, and in particular related to the Martin Reeds Initiative and re-energizing and reinvigorating that. Our county park system has got this story walk challenge going on. So they're going to have in some of our county parks this opportunity for parents to walk through a story with their kids. So that's a novel, kind of a community-based way to work on literacy over the summer. We have the Dolly Parton Reading Initiative. That's a program with the Library Foundation. They are going to be funding that with us and several other funding partners to get a book into the home each month for families, again, in that 2 to 5 year range. Many of these families who come to us from other countries aren't literate themselves, so they don't have books, magazines, resources in their house. I have a 3.5-year-old grandchild. When he comes to see me, he picks up every magazine that he can see a boat on because he loves the water, loves boats. And I go through that magazine with him. He doesn't read yet, but he can point to things, and it's all about vocalizing, listening, and engaging them in the process.
100%. That's amazing. And while we were at the TC Masterminds meeting, one of our members, Missy Campbell, she's also the executive director
for the Palm City Chamber, which I'm a board member of.
You're a board member of, and she had really great insight about children and what you should be doing with children when they're young, when they're infants, And one of the things that stuck out to me was turning the child facing you instead of facing out in the stroller. That you didn't, you never think about stuff like that.
Thanks for leading in, because I have some more great tips.
All right, great. Awesome. Way to go.
For new parents. Missy is actually on our steering committee for the Martin Reeds Initiative. So we're grateful to have her. But start reading to your kids, start engaging with them from an infant. I know with my own daughter, she's now 11. Even when she was in the womb, I was talking to her. I was reading to her. I was playing music. And once they're born, it's great one-on-one time to start settling them down as you're getting them ready for bed. Talk. Like I said, I like to talk. So I was going through the grocery store with her and showing her what I was putting in the cart and telling her what it was, what color it was. Have that communication and talk with your children. Let them, just narrate your day. I know it's hard for some adults even, but limit screen time. Screen time is not a way to communicate and to develop that cognitive relationship that children need. Create a great reading space. We had, with my daughter, a little reading corner where we set up pillows and blankets. It was a little reading nook, and it was great for her to, whenever she wanted to go and read a book, she'd go and grab the book. She knew where it was. And, I did a lot of thrifting for books, when I was a young mom and making it happen. Play word games. We loved playing Scrabble. Now we love playing Scrabble and any games in general. Just be engaged with your kid and make reading fun. It's engaging that, and get those 300 million words between 0 to 5 years. That will help develop, because most of the communication that your children have, it's all derived from the language and the way that you speak to your children. So
that's fantastic information. And to your point about screen time, I mean, you look out, no matter where you are in this country, and you see young children, young adults, and even children, you see them on their iPhones and constantly. I mean, Kathy and I was out at a restaurant, and every time we go out to eat, we purposely look around. We were at Sailor's Return the other night having dinner, and everyone around us are on their bloody phones, not communicating to the person across the table from them.
One of my favorite things that I do with my daughter, since she was young, whenever we go out to breakfast, lunch, dinner, whatever we do, we don't have our phones. We play games. We have the piece of paper from her kids menu, or we at brunch, brunch or breakfast, whenever we go to Reuben's in Palm City, we stack the coffee things and we make a game out of it and we count them and we play and we have fun. And I've gotten so many people who have complimented me as they were leaving. Wow, your kid's not crying or screaming for a screen. And my daughter has never, not to toot my own horn or anything, but
I'll toot your horn.
It's been so important. And that's why now at 11 years old and her going into 6th grade, I'm not as worried because our communication is very open. And so that's something that is so important as being a parent and being engaged with your child.
Kudos to you. That's fantastic. And I think, many of us can learn that, and start implementing that with our children. So I'm sure there are people out there that are probably interested in looking at your program guides and looking at your website. Where can they go to find all this?
So right now, being 90 days in, I took a look at what we have for our digital platforms. And we are on Instagram at CSCMC89. And we are at Facebook at CSCMC. We are currently working on our website. I had my first meeting yesterday with our new developer. So I'm super excited about that. We're going to make our website another resource for individuals so that they can see the programs that we fund and the different providers. And we're going to have links back to everybody's page. So if you wish to donate to those sites, to those programs, to those providers, you can definitely do that with a link from our page. So that'll be out in about 4 to 6 weeks, but it's at www.cscmc.org. So it's Children's Services Council MC, MartinCounty.org.
And so how many people do you have on staff? I meant to ask that earlier, David. What's the total amount of people you have?
We have 11 staff members.
11 full-time?
Yes.
Fantastic. Volunteer opportunities?
Yes. In fact, we've got one in the office right now, a student intern from high school who's an artist and a digital genius, I'm told. And he is going to be working with Cherie as we migrate and update our website. And he came up with some great ideas yesterday on his first day. So
that's impressive. Amazing. I'm so excited to hear that stuff like that.
His name is Austin Marks, and he is going to be a sophomore at Martin County High School this year. So I'm super excited.
Way to go, Austin, young man. That's fantastic. Keep up the great work. And this is what it's about. And donating, volunteering, and giving back to your community. These are today's children are our leaders for tomorrow. So, and that's fantastic.
I also wanted to give a little shout out. I am going to be dancing this year because somebody accidentally broke their foot. So they needed a backup dancer. And I was an alumni for Dancing with the Martin Stars from 2018. It's a fundraiser for Martin County Healthy Start Coalition. We are a proud supporter of Martin County Healthy Start Coalition. I am not fundraising, but I'm raising awareness to the programs and to all that they do. And you can catch me September 25th at 7 p.m. Starstruck. I will be dancing with my other alumnus, Jean Law Scott, who is amazing. And I'm Two Left Feet McGee, so hopefully she can pick up
I don't
the
believe
rest.
that 1 minute.
So it'll be a great experience. So please check that out as well.
That's fantastic. That's good stuff. Guys, this was great. This was good information, some information I didn't know. So it's really good to have you both here. Tom, do you have any feedback or questions or comments?
Yeah, I do. I have a question. Of course, you have the funds from the taxpayers. Are you guys also a nonprofit organization where you accept donations? And how could someone donate if they believe in your cause?
We are not a not-for-profit.
Okay.
And thank you for bringing that up because we have this conversation all the time. We are a a special taxing district, essentially,
A government
local
agency.
entity of government. Yeah. So we're
Gotcha.
not, we do and can, given our structure, accept donations. We do that primarily around, for example, our splash program, which is our summer swimming. Runs from Memorial Day to September, where we teach water safety education to both parents and youngsters.
That's great.
We have 2 locations, the Splash Water Park and the YMCA. So that is a real attractive thing for people to contribute to, because they charge us a nominal fee for those lessons, and you can support a child for, I don't know, $30. They can get that whole series of 8 lessons. So those kind of things we do all the time.
Good stuff.
And so people can go to your website, and is there a donation button or mail in a
There's
check?
going to be.
Oh, right. May I recommend?
Just wait for it.
Okay.
4 to 6 weeks. The
Very
whole
nice.
we go on our next break. And real quick, I just want to give a shout out to WellMed Medical as well. We are really doing a great job, Tom, in our collaborative efforts with WellMed Medical. And so we give them a big thank you for being a sponsor of our show. And by the way, if you're looking for a good primary care physician, you don't have one, you're not happy with who you have, you're not happy with the time that's allotted to you as a patient, you may want to consider checking out WellMed Medical. A good physician is always in great demand, and so many currently don't have a PCP. So go check out WellMed Medical for all of your primary care needs. And they currently have 4 convenient locations here on the Treasure Coast. Tom, where are they?
Sebastian, Fort Pierce, St. Lucie West, and Stewart.
Fantastic. So we're going to talk to you when we come back from our last break about health facts, or 3 certain health facts I want to share with you. And then we're going to talk about some short-term medical plans and some statistics with children. So since the Children Services Council's here in the room, we're going to continue our conversation about children. You're listening to the Quality of Life radio show on WSTU 1450, America's Heritage Station, and WPSL 1590, and watching us live on what, Tom?
Facebook.
What's that?
A book with a face?
I love
don't
those
know.
kind of books.
Never heard of it.
Stay tuned, folks. We'll be right back. Welcome back from our short break. You're listening to the Quality of Life radio show. And another final thank you to one of our last sponsors is United Healthcare. Did you know that you can enroll in a Medicare Advantage plan that includes access to their statewide provider network? That's why now is the time to take advantage of a plan from United Healthcare. With a United Healthcare Medicare Advantage plan, you get more for your Medicare dollar, including benefits like $0 copays for covered preventative and dental services, 0 copays for lab services, and of course, access to the United Healthcare Medicare National Network. Talk to a licensed representative today. I think I know someone in the studio.
Two of them. 772-210-1020.
No, it's 772-210-1020.
Tomato.
Okay. We're not talking about tomatoes today, Tommy. All right, so we're moving on. We've got about 17 minutes left in the show, and I'm going to talk to you. I don't have any strange or weird news stories today, but I do want to share 3 health facts to share with everybody here this morning. So it is, by the way, does anybody know what these are above your
eyelashes?
Brows.
Yeah, eyebrow. And David, do you know what the main purpose of the eyebrow dysfunction is?
Collect things that perhaps come from outside and block them from your
Yeah, and keep sweat out of the eyes, pouring into the eyes, because you get sweat into your eyes, it burns, and you can't see, and then you're like,
I get sweat in my eyes anyway.
You get more than sweat in your eyes, I think, Tom. Number 2.
Well, when you're wearing a mask, it tells you whether you're smiling or not.
Well, we have the Palm City Chamber on the phone. Charlie. I can't read your writing. We have Charlie on the phone from Palm City. You know what? Let's get Charlie on in just a second. Let me finish this. Smokers reduce their lifespan expectancy by 11 minutes per cigarette. That's horrible. 11 minutes off their life per cigarette. Mm. And then the last one is, and then we'll bring Charlie on the phone. Feeling down? Then eat spinach, elk, oysters, crab, and bananas. They've proven to positively impact your mood. Elk. All right.
Oh, yeah.
Charlie, is Charlie on the phone with us?
Yeah, man. Okay.
Hey, Charlie, good morning.
Hello.
Thanks for tuning in.
Okay. I called your office, and I just wanted to know if you got the message. There's a lot of disabled vets in the area, and I researched this. You know that plan? Is it Plan D, where you have to? It's $42, $45 a month. Hello.
Yeah, we got you, Charlie. So you're talking about Part D, or?
Okay, no, it's the remember when you have Medicare and they force you to buy like for drugs. Plan D, is it called?
Yep, Part D. That's for prescription drugs. Good. You got it.
Now, as a disabled vet, I can get free health care at the VA and medication. I choose not to. I hate the VA. Mm-hmm. I have enough money to cover myself. Okay.
Yep.
But I researched this thoroughly, and remember, if you pulled out, they threatened if you stopped it, and then you wanted back in, let's say 10 years later, they were whacking you a percentage every single year as a penalty.
That's a late enrollment penalty. Yep, correct.
Okay, that doesn't count for veterans.
That's correct.
Thoroughly, I called Medicare. I spoke to the insurance lady that I used, and I actually confirmed it twice because I didn't want to mess myself up.
That's right, Charlie.
Right?
You're 100% right.
Okay, because I'm glad. So I hope you're telling your people that when you think about it, $45 a month times 12 is a lot of freaking money for people. Some people, anyway.
That's correct. And by the way, for vets out there, and by the way, I want to say thank you for your service too, Charlie. But and for vets out there, a lot of those vets are having some troublesome time in making ends meet. There are Medicare plans out there that you can enroll in that does not have a Part D or prescription drug plan, because obviously many vets get their drugs from the VA. So you can enroll in a Medicare Advantage plan. I believe it's called the Patriot Plan, and it will give you back your Part B premium. So instead of having your $148 a month coming out of your Social Security check, Charlie, they will eliminate that, and you will no longer have that fee coming out of your Social Security check.
You know, honestly, I'm having my friends. I think I told you guys this. I'm lifting his house. He's in a floodplain in Simsbury, Connecticut. So I'm going to raise his house. 100,000. I'm going to chip in.
Look at you. Good job.
I'm not worried about $148 a month or whatever it is.
Yeah, well, you're one of the lucky ones, Charlie.
I'm one of the successful ones.
That's
God
fantastic.
bless you. I've been retired since I was 57.
Oh, God bless you too. I appreciate you, Charlie.
And I didn't start taking my social till 64. Goodbye.
Good man. Take care, Charlie. Thanks for tuning in. All right. We appreciate that. And again, for all the vets out there that are listening to us, I salute you, and we thank you for your service to our country and our communities. So real quick, Tom, I want to kind of touch base. We talked about children and what happens to children on a daily basis, on an annual basis. 9.2 million children from the ages of 0 to 19 are treated in emergency departments for non-fatal injuries. We're not going to talk about the over 12,000 that die from those injuries, but over 9 million a year.
Is this just in the United States?
In the United States, right? So
that's a lot of people.
Males have higher injury rates than females.
Of course.
We
jump off things. We
and climb things. Yep. For children under 1 year old, falls account for over 50% of those injuries. And I'm going to share the 6 main non-fatal injuries in children. So falls, again, we talked about that as being the leading cause for all age groups less than 15. Being struck by or against an object, animal bites, insect stings, overexertion. Kids don't ever overexert themselves. Vehicle occupant injuries and injury by fire and burn. So those are the leading causes of accidents. And I want to just point out to families out there who have children. You may be on a health insurance policy plan that may have a high deductible, and we know you've just heard right here what the statistics are with children. So it's important. We had a family come into my office last year. It was before Thanksgiving, and it was a family of 4. And Maria came in with her husband and her 2 sons, and they didn't want to enroll in an ACA plan. They didn't qualify for a subsidy because it was going to be double the premium. So we looked at a short-term medical plan, which is a PPO plan through the Aetna PPO network. So we looked at a $5,000 deductible plan. It's a 100-0 plan. So once the family or once an individual hits the $5,000 deductible, then everything's covered 100%. Well, that premium for a family of 4 was only $825 a month. Now you may say, oh my God, that's a lot of money. Well, if you had that same $5,000 or so deductible with an ACA plan, it would be probably double.
Absolutely.
Double that amount. Now, what do you do to cover the $5,000 deductible for each family member? Well, you buy a gap plan, a $5,000 gap plan. So I told Maria and her family that they should enroll in the gap plan, the plan enhancer, the AME, which is an accident medical expense, the SIP, the sickness insurance plan, as well as the CHS, the cancer, heart attack, and stroke plan. So those combined together was only $57 a month for the whole family of 4. So for less than $882 a month, the family's protected with 0 out of pocket on a national Aetna PPO network plan. So I got an email yesterday from the father, said his son Santiago broke his arm. He sent me his bills. He showed me all the expenses that he's paying from that. Then he has to go to a specialist. And with all these bills, I said, good job on, listening and heeding to my advice and getting the gap plan, because now what you can do is fill out this form, submit it to the carrier, and they're going to reimburse you for all those expenses. And I've got a copy of the bill here that I'm looking at. And what's really cool about it is that with the Aetna National PPO Network plan, so for example, one office visit was $482 just for one visit. And because they were part of the Aetna PPO network, it was adjusted down to $195. and all these that the X-rays got adjusted, the follow-up visits, the orthotic management training, and the outpatient visits, and additional X-rays of the forearm and so forth. So instead of paying full price, if you didn't have insurance, now you have the Aetna PPO network plan. You get that balance reduced, and that couple $1,000 visit to that doctor end up only being $885, which now gets reimbursed to the family. Tom, you are pushing many of these plans, and you're doing a great job for getting that message out about different possibilities to protect your quality of health.
Absolutely. And once somebody understands the purpose of it and how to utilize it, and how for pennies on the dollar they can insure themselves against a $5,000 deductible, or in many of the marketplace plans or the short-term medical plans, they can have a $5,000 or higher. I think the maximum on a ACA plan is $8,550. Some people might have it, but you've worked hard to save that money.
Why give it to the right?
Or put it on a credit card, or pay $5 a month for the rest of your life to the hospital. But if you have an accident, you break an arm, your son breaks an arm, and the bills, they just stroke you a check. The company, just like a lump sum check of $8,550, it pays the maximum out of pocket, pays the deductible. That accident plan that Maria and her family purchased for $57 in less than a year. So what, $300 or $400 out of pocket? They're now going to get a check for $5,000, because I'm sure all the bills are going to be more than the $5,000.
Absolutely.
So it's that GAP plan just pays them $5,000. Now their deductible is met for their son and for the rest of the year. Hey, if you're going to have accidents or go to the hospital, this is the year to do it now after the deductible is met. So congratulations on, for them taking your advice, number one. And number two, tell everybody even if they have a good health insurance plan, if you have a deductible or a low deductible, but you have an out-of-pocket maximum for the year, if you're only going to reach that for most people if they have an accident or they get sick and they have to be hospitalized, that's when it's going to be utilized. And so it's
and you had a client, Tom, that had an accident and used that.
Well, and interesting enough, I had an individual who I had talked to like 2 years ago, and they didn't want to do the plan, the short-term medical plan with the accident. And they thought for some reason he wasn't very trusting of me, which I don't know why, but
what?
Poop? Yeah. So somehow he went off and got the same plan and did not take the accident, the separate plan.
The GAP plan.
The GAP plan.
Right.
He said, my wife and I, we're healthy as horse. We never have anything. We haven't been to hospital doctors. Then what happens? He calls me like a year later. He said, do you remember me? Kind of sheepishly. I said, I sure do. I did remember him. And he said, you never guess what happened. We went and got the same plan you were trying to sell us. We didn't take the medical because we thought you were just trying to sell it, push it on us. And I never push it. So I don't know how I got that. So he said, my wife got out of the car, slipped in the garage. She broke her ankle. And we're in the emergency room, and she's in the hospital, and we are paying the bill off. They didn't have the money or the credit card or whatever. So we're paying them like $100 a month until it's paid off. Said, I should have listened to you. They're my clients now. So they literally just rewrote a new policy with the accident and medical plan on it. And so, hope you're not going to have to use it, but they have the protection.
And to your point, Tom, I mean, not everybody heeds our advice. Right. So many times, and we recommend this GAP plan to cover those gaps, to offset those mitigating financial costs, right? So it's really good to be able to have a GAP plan to take care of that. And even if you don't have a medical plan with the company, you can still buy a standalone GAP plan. I have it for myself. To give you an idea, a 40-year-old male can buy a $5,000 medical plan, $5,000 deductible, 100 plan for only $297 a month. If they are preferred status, that drops that premium to $241 a month. So a 40-year-old male can have a medical plan for $241. And the GAP plan, the $5,000 GAP plan, is only $21. Come on.
Absolutely.
It's
And I
cheap.
have a plan through the marketplace with an out-of-pocket maximum of $8,000. And I have an $8,000 accident medical plan. I'm 59, so I pay $40 a month. It's like,
And there's a lot of young adults out there, 25, 30 years of age, and they don't want to get on an ACA plan for whatever reason. And a short-term medical plan, you could take a 3-month out plan, or you could take a 3-year plan, so from 90 days to 3 years. And for a 25-year-old, just to give you an idea, $75 a month. So there are some great premiums out there, great opportunities, great alternatives to the Affordable Care Act, or Obamacare that it's known as. And by the way, and we haven't touched because we're obviously out of time, but the ACA enrollment period, the special enrollment period, ends
August 15th.
Guys, tick-tock, you're running out of time. So if you don't have a health plan, you may qualify, you probably will qualify for a higher subsidy. In fact, more than 50% of Americans who qualify now, due to the ARPA Act, the American Rescue Plan Act of 2021, they are seeing premiums less than $100 a month. So call the experts here at Owen Insurance Group. You can reach us at 772-210-1020, and that one of our agents and professionals and friendly folks give you a helping hand. And by the way, thank you again to the Children's Services Council of Martin County. Remember, if you have questions, you need help, 211. Very easy to remember that. All right, next week, Tom, we have another special guest coming on our show, Teresa Aronson of the St. Lucie County
Chamber of Commerce.
And you are a
proud member,
soon to be a long-standing member of the St. Lucie County Chamber of Commerce. And by the way, next week again, Tom and I will continue providing some more valuable insurance planning solutions. A lot of great information coming out that you need to know. There's some new plans coming out for 2021. So we'll be sharing some of that information with you on the next upcoming shows. Hey, thanks so much for joining us this morning. We hope that you enjoyed the show. And please share us with your friends, your family, and your neighbors. Stay safe, Treasure Coast. Keep healthy, be happy, and enjoy
your
quality
of
life.
Yeah.
Take care, everybody.